Alrighty, we are gonna go ahead and get started with our next session, and I have the pleasure of introducing Dr. Kannon Haskins. So Dr. Haskins is a retired family medicine physician from Manchester, Georgia, and experienced in both military and rural healthcare. After earning his medical degree from the Medical College of Georgia, he served as a U.S. Army physician in Germany, where he commanded clinics and cared for soldiers and their families. He later returned to Georgia to practice family medicine and served as the medical director of the Roosevelt Institute for Rehabilitation. Since retiring in 2002, Dr. Haskins has focused on recovery and service, remaining active in 12-step programs in the Columbus Caduceus Group.
Thank you, Samantha. Good morning. My name is Kannon, and I'm an alcoholic and I'm an addict. And now that we got that out of the way, let's begin with my presentation. So, I'd like to talk to you today about the physiology of substance abuse disorders, impairment and recovery in healthcare, and then my personal journey, hopefully if we have enough time. So, what is addiction? Is it physiologic dependence? Is it caused by a lack of willpower? Is it an amoral condition, or is it perhaps a brain disease? I'm skipping over choice because I don't really have time to dedicate to that, so I may pass that slide. Dependence. Basically, it's when the body adapts to a mood-altering substance to the point that it gets used to it and it becomes necessary. As the body adapts, it develops tolerance, requiring more of the substance to get the desired effect. Once that substance is either discontinued or reduced, withdrawal symptoms occur, and withdrawal is basically the opposite of what the substance was trying to achieve. But physiologic dependence is not addiction. Lack of willpower. I won't spend much time on this slide, but I think everybody in this room would agree these two gentlemen here have climbed the ranks of success and they have tremendous willpower. However, both of them had a 15-year addiction history. Mr. Samuel L. Jackson on the left struggled with cocaine and heroin abuse. This was actually supposed to be Robert F. Kennedy Jr., but maybe I shouldn't have put that up. This is actually Rush Limbaugh. Limbaugh got addicted to OxyContin, and he went on the air to announce that he was going into rehab. I need to add that when he announced that, previous shows that he had on his talk show, he had really condemned drug abuse and drug addiction, and then once he became one, he changed his tune. Is it an amoral condition? I present to you Dr. William S. Halstead. Dr. Halstead was a pioneer in surgery in America. In fact, he is considered the father of modern surgery. He is the one who pushed the issue of washing hands between cases, sterilizing equipment, and wearing rubber gloves. Well, in 1884, he read a paper by Dr. Karl Kohler in Heidelberg, Germany, that said if you took a tincture, a little topical tincture of a substance known as cocaine, and drop it on the eye of the patient, then you can do surgery on the eye and that patient would not feel it. So Dr. Halstead started to do his own experiments. He decided, well, let's put it injected at the base of a root of a nerve and see if it anesthetizes the branches of the nerve. And sure it did. What if we can get general anesthesia from cocaine, like injecting it into a vein? Well, it didn't anesthetize him, but it did hype him up, got to the point where he recommended it to other physicians, saying you can see more patients, you can do more surgeries, you can stay up longer, you can be more effective. He even got his surgical residents hooked on it. Well, in the end, it about killed him. By the way, he also got hooked on morphine and with his experiments with general anesthesia. He never got off the morphine, but he did get off of the cocaine. And as an amoral condition, I doubt it, because he went on to be one of the 4 founding physicians of Johns Hopkins University. Is it then perhaps a brain disease? Well, why do people take drugs in the first place? To feel good? To have novel feelings and share them, or to feel better? pain, physical pain, social pain, emotional pain, psychological pain. Also for performance enhancement, as it was in Dr. Halstead's case and in my case. Definitions: substance use, a pattern giving without giving rise to consequences. Substance abuse, using pattern which may give rise to consequences. Substance misuse, using despite consequences. Dependence, use, tolerance, consequences, and withdrawal. And of course, addiction has all of the above, except now there is the compulsive cravings and significant time dedicated to acquisition. That is a key feature of addiction. Dopamine, you hear a lot about it. It is the pleasure neurotransmitter in the brain. Little neuroanatomy review. For the folks who are interested, the main areas that we're looking at here for addiction and substance abuse are the prefrontal cortex, which is the executive part of the brain for the right and wrong, your logical center of the brain. Then there's also the nucleus accumbens, which is the pleasure center of the brain, which gets very activated with drugs and natural rewards. The VTA, the ventral tegmental area, is the gateway to the nucleus accumbens. It basically acts as a filter so that when the nucleus accumbens is activated, it draws your attention to whatever that is, be it a substance or be it an activity. You're probably experiencing a little bit of dopamine right now looking at that. You may not even be aware of it, but you might say, I want a puppy, unless, of course, you're allergic. Normally, dopamine and other neurotransmitters are synthesized in the cell body of a neuron, travels down the axon, and then it sits in these little vesicles at the bottom there, at the blow-up part. And those vesicles contain dopamine, and when that nerve gets a signal to release the dopamine into the synaptic cleft, that dopamine then goes to another neuron, which it becomes a chain reaction. So that's how the pleasure syndrome, the pleasure symptoms are propagated. Natural rewards elevate dopamine. Food does, sex does. GABA, gamma-aminobutyric acid, is another chemical, and GABA acts as an inhibitor to dopamine. Otherwise, if you just had dopamine flooding your system all the time, you would be happy all the time, or you might have schizophrenia, because dopamine is also involved with schizophrenia. But anyhow, GABA is a natural balancing thing so that you don't get too much of one or the other. But opiates and GABA and dopamine. So what do opiates do? Opiates interact with an endogenous pain receptors in the brain. That's how you get the pain relief. But they also inhibit the release of GABA, GABA being the thing that blocks dopamine release. Without the GABA, dopamine levels surge, particularly in the nucleus accumbens and the ventral tegmental area. These surges can cause intense euphoric feelings in persons that are susceptible, reinforcing those behaviors to seek the drug out again. Eventually, though, prolonged use of opiates will eventually alter the brain chemistry, leading to downregulation of the production of dopamine. Stimulants and dopamine do the same thing. Actually, I'm going to skip past this and go to this slide here. These are drugs' effects on dopamine release and dopamine secretion in the brain. Cocaine, amphetamine, nicotine, that's the subject of another discussion. I want to focus on the morphine here. Morphine causes a spike, and it takes a bit of a time for it to go down. So these are drugs that actually affect the dopamine levels in the brain. What happens over time? Because the neurons can't control how much dopamine is being released in the synaptic cleft, the receiving neuron actually has a way of counteracting that. It starts absorbing the receptors. That's one of the reasons that tolerance develops. And that's one of the reasons that the cravings develop, is that you now have the dopamine being released. You can't do anything to block the reuptake, but you can block the receptors of the receiving neuron. And when you get that happening, that causes stress in the body and stress in the brain, cravings, intense cravings, to the point that nothing else matters. And the cost of that high that was experienced, it lasted for a few hours. Well, it goes through a month's worth of good feelings and it becomes like our federal government. You have a huge deficit and it takes a while to recover from that. So functionally, we know that dopamine 2 receptors, those are the receiving receptors, are decreased by addiction. As you can see here, these are PET scans. Red areas show increased activity of dopamine. Where it's green, there's lesser so, but if you look on the controls over here, we've got healthy brains, nucleus accumbens, which have dopamine activity that is, quote, normal. For folks over here who are addicted to various substances, you see that the dopamine activity is decreased. But what if I were to tell you there is a study that says, or that came out in 1999 by Nora D. Folkow, director of the National Institutes on Drug Abuse. She published a study that was quite interesting. She took 23 healthy males, mean age 34, standard deviation of 7, did not have any psychiatric, metabolic, or emotional or medical disease or drug abuse dependence were studied. All were given a radioisotope that would light up the nucleus accumbens, the pleasure centers in their brain, and they were brought back to see what the PET scans were done to see how that activity was. The same subjects were brought back on a different day and given methylphenidate, Ritalin, IV. And they were asked, how do you feel after this? 12 of them described the experience as pleasant. 9 said it was unpleasant. 2 said they couldn't tell anything. Take a look here. The ones that described it as pleasant had fewer dopamine receptors. The ones that described it as unpleasant had more receptors. Both groups here are drug naive, meaning that they had no prior history of drug use. This is even, so he or she, sorry, it's a he, that's an unfortunate part of the study, it was only men, but this individual right here had not burned out his brain yet. So the ones with low receptors report methylphenidate as being pleasurable. Does that mean that those who enjoyed it had fewer number, that is true, those who enjoyed it had fewer numbers of dopamine receptors. Those who found the experience as unpleasant had a greater number of dopamine receptors. Does that lead you to addiction? We don't know, because that study was a one-time study back in 1999, and part of my research is to find out if anything further has been developed on that, and so far I have not found out anything. A normal brain and an alcoholic brain damage. You can tell the difference. On the alcoholic side, you see decrease in brain mass. But what about these two slides? One's an addict and one is not. But both of those are normal scans. How can you tell the difference? Answer. When I got admitted to rehab, I was asked a series of questions, neuropsych testing. Okay? Everybody hated it because it told you the truth. Anyhow, I was asked, name the 9 planets. At that time, Pluto was still a planet. Name them. I could only think of 3, and I forgot about Earth. Next, remember 10 objects after 3 minutes. I could think of 2. I was like, listen, I'm hungover. I just had a big plane flight. Give me a break. What's the speed of light? That got my attention. I have been a nerd way before it was cool to be a nerd. I knew what the speed of light was before I was 10. It's 186,282 miles per second, or 299,000 kilometers per second. That day when the tester asked me that question, I couldn't think of it. That got my attention. I was like, there's something wrong with me. I know it now. I want to quit, but I keep relapsing. Why do I keep relapsing on drugs? I have heard that so many times working with folks in 12 steps meetings and stuff. This is my 4th relapse. This is my 10th relapse. Well, one of the reasons is you're not thinking straight. It takes a while for the brain to recover after you've been using drugs or alcohol or opiates in this case, such that the frontal lobes, which you're looking at up here, notice the bright green and bright red activity of someone who is, quote, normal. I hate using the word normal because I don't even know what normal is. Thank you. Yeah, I don't even know what normal is anymore. So, but this is, in the case here, this is actually a marijuana abuser who'd been using marijuana on a daily basis. After 1 week, they're still not got great metabolic activity up in the frontal lobes. 3 months, still not a lot. That's one of the reasons why people who are addicted and go into treatment, frequently a 30-day program is not enough because their brains have not recovered enough to make good decisions. I was in rehab for 6 months, saved my life. And it taught me that I needed help and I need to know when to ask for help. And it gave me time to let my brain try to cool off a bit. So that's one of the reasons. Another is withdrawal symptoms. Now, I think Harrison's book of internal medicine says that withdrawal basically begins a short time after you've ingested or taken it. And then if you don't get another hit, then it peaks in 72 hours and then slowly goes away over a few weeks. That's a bunch of BS. It took me 2.5 years to get over the withdrawal symptoms. Now, granted, they weren't as intense, but you'll see a slide of me here in a little bit, 3 or 4 months after I got out of treatment. I'm sweating like a pig. That's because I'm still in withdrawal. And I can tell you, it's very uncomfortable. And it's extremely tempting to pick up and use or drink again when you're hurting that way, because you know you can get an instant relief. But you know what? Addiction is very similar to other diseases when it comes to relapse. For example, type 1 diabetics. Within the first year, 30 to 50% relapse. They don't follow what the instructions were. Same thing with hypertension. I've known, when I was practicing, I've known plenty of men who said, I can't take this blood pressure pill. Why? Because I can't get it up anymore. It's like, well, okay, we need to switch the medication here. Just don't stop it, you know? Asthma, just the same. So, forget about BART over there because that's another part of the slide we don't have time to cover. But what I wanted to say is that addiction is like other diseases. It's preventable, it's treatable, it changes the biology, and if untreated, it can last a lifetime. Into part 1. Sid and Nancy, that is a film about, not really a documentary, it's more of a biography of Sid and Nancy Vicious. Sid was the lead singer of the Sex Pistols back in the 70s and 80s. It's a very difficult movie to watch. He was a heroin addict, and so was she. Impairment and recovery in healthcare. What is an impaired healthcare provider? The term impaired professional in the context of healthcare refers to a worker who is unable to practice medicine with reasonable skill and safety due to physical illness, loss of motor skills, or excessive use of drugs and alcohol. Now, this is a scary statement on the next one, and it's scary to me because I've been there. Many healthcare professionals who develop a substance use disorder can function effectively, but this depends on their stage of illness. As healthcare providers, we're pretty independent, okay? And we have to be on our P's and Q's at all times, which means that we always are going to put our best foot forward. I can tell you the healthcare providers that I've known that are in recovery, they went years in early substance abuse, and no one picked up on it because they were able to cover it so well. What's the most common cause for physician impairment? It's what we're talking about today, substance abuse. Dr. Talbot, who started Talbot Recovery, which is where I went for rehab, did this study back in 1987, and it is still the same. Reasons healthcare workers turn to drugs and alcohol. Same reason as anybody else does, but on top of that, frequently it's due to long hours, fatigue, and performance enhancement. We also have this sense of being invincible. I can handle this. You know, I was getting opiates for a medical condition. Oh, I can increase the dose. I know exactly what it'll do to me. I can handle it. I can control it. Relaxation makes sense. Mood-altering pharmaceuticals are relatively more available to healthcare providers than they are the general public. Very true. Underlying person, you put somebody under stress, you'll find out what their actual personality type is, okay? If that personality type is interfering with that person's ability to carry out their work, they will try to find ways to ameliorate that, and frequently drugs and alcohol are ways to turn to that. What is the prevalence? Okay, I've got several slides on this, and these are different studies. This is from 2015. 27,276 physicians were sent out questionnaires, and only about 27% completed the surveys. 12.9% of males and 21.4% of females met diagnostic criteria for alcohol abuse or dependence. Abuse of prescription drugs and use of illicit drugs was rare. I want to read that article in more detail. All I could find was the abstract, but since Dr. Sumner has given me, allowed me to get into the library here, I can actually pull up more than the abstracts now. So I would like to dig into a little more detail with that because I find that very shocking. Another study, sample of 9,600 physicians pulled randomly from JAMA database, 59% responding after 3 mailings. 10 to 14% had some type or were at risk of becoming chemically dependent at some point during their career. By the way, 10 to 14% is about what the general public's rate of risk is as well. This is an interesting one. 5-year study, longitudinal cohort study of 904 physicians, 87% were males. I hate that. Alcohol is the primary drug of abuse. That's easy. It's very easily available and is socially acceptable. Opiates were next, not surprising, followed by stimulants, then other substances. Multiple substances, 50%. Previous treatment for addiction, 17%. Anesthesiology, emergency medicine, and psychiatry appeared to be overrepresented in PHP programs. That's very interesting. Which came first, though? Was it the stress of those jobs, or does those specialties attract a certain personality? I don't know. By the way, you'll see it in a second, but I'm curious. Who has the lowest risk or the lowest rate of being in rehab as far as physician? What specialty do you think? Dermatology. Say again, sir? Dermatology. That's a good one. But no, actually, it may even be the best one because I didn't even see them listed. So that may be, you're maybe right. Again, that may be also let me rephrase it. For the physician specialties that are in treatment, what do you think? Bingo. Who said pediatricians? Yes. Pediatricians have the lowest risk, rephrase. Pediatricians have the lowest rate of being in treatment and rehab. This one here, again, just reinforces that 10 to 15% of healthcare professionals will develop some type of drug use in their, or misuse in their career. Reasons, medical students, they like to party, recreational purposes, but then they grow up and become attendings and residents, and then they realize, oh God, I got to live like this for the rest of my life. So they start self-treating pain, anxiety, and depression. Who is doing what? Okay, this is the slide I was talking about. Anesthesiologists, not surprised, they have fentanyl and sufentanil in the OR. Surgeons, not surprised there either. That's pretty stereotypical, I would say, alcohol and nicotine. Psychiatrists, benzos, ER docs, they'll do whatever. Pediatricians, lowest rates in treatment. Family practice, alcohol and opiates. That was me, but I would also do anything. Dentist, alcohol and opiates. Problems encountered with obtaining accurate data. Trusting that this is an anonymous self-reporting survey. When I got those in the mail and I was actively using, oh, hell no, I wasn't going to fill one of those out because somebody might actually be trying to test me and find out it was actually me. Fear of reprisals when reporting. Businesses, drug problems. We don't have any drug problems. Well, how do you know? Do you ever test? No. Well, you don't know. Yes, we know. We would be able to tell. Sorry, no, you would not be able to tell until it's too late. Also, identifying somebody with a drug problem in a practice can increase the rates of insurance coverage. Signs and symptoms, okay. I collected these from myself as well as other physicians and nurses, healthcare providers that are in my caduceus group, also some books too. None of these by themselves is indicative of it, but when you start seeing a conglomeration of some of these symptoms, there may be a problem. Cold sweats in an air-conditioned environment, hot withdrawal, frequent trips to the restroom, get your fix, taking on more responsibility than it seems to be humanly possible to manage, early to middle stages, and then not being able to accomplish anything, by then it's late. Keeping unusual hours, disappearing for hours at a time without letting others know where you are. Chronic cough. Chronic cough is great. It'll get you cough medicine all the time. Mood swings, excessive use of assistants, slurred speech. I don't know if there's dictation anymore. Do docs dictate or they just use typing? EHR. Ooh. Wow. Okay. All right. So that may be a little anachronistic then. Memoranda or letters that provide too little or way too much information. Not showing up on Monday or Tuesday if it was a 4-day weekend. Nodding off in meetings. Pressured, hyped up speech, micrographia, like writing really, really small. Alcohol and breath, obvious. Loss of appetite. Sweets, craving, that's frequently a sign of opiates. Tremor, absenteeism, tardiness, belligerence to supportive inquiries. Persistent errors, changes in personal hygiene, bloodshot eyes, unconscious or dead. It's too late. Dr. Talbot. An addict or an alcoholic who loses their job will cut off their financial lifeline, and thus they will preserve that to the extent that everything else falls by the wayside. By the time their job performance has begun to suffer, they are already in the full throes of addiction. Barriers, we have significant independence. Who's looking over our shoulders? Actually, I think there's more of that today than it used to be when I was practicing. Social and financial concerns. The family doesn't want to lose their position in the community or go broke. Colleagues will be reluctant to report for fear of reprisals, protecting the hospital also from scandal. Small practices have a more difficult time absorbing the loss of a provider while they go into treatment. And our egos, okay? I had a medical reason for taking the OxyContin I was given, which we'll get into later. Every organization, hospital, even a small clinic should have some type of algorithm or SOP for identifying workers, be it doctors, healthcare, anybody who works in healthcare. There should be an algorithm or an SOP that is designed to help you identify the person in a non-punitive way so that they can get help, or help investigate that person without causing disruption. What to expect? Defensiveness. I'm only taking what my doctor ordered. Well, I am the doctor and I ordered it on myself. Deflection. You need to focus on Dr. House instead. I know he's an addict. Okay. Rationalization. I'm under a lot of stress. So would you. And I can quit anytime. Just give me one more week. Fear. I'll sue you in the hospital. You keep going up this thing, I will sue you. Denial. I only drink when I'm not at work. Bargaining. Please give me a chance to do this on my own. And then finally, if you get to this point, which this is the point where you want the person to be, is I know I need help and I'm sick and tired of being sick and tired. Cost for rehab, anywhere between, depending on where you go and how cushy it is, $5,000 to $88,500 per month.
Not a typo?
What's that? That ain't a typo. No. No, and I can tell you the name of the place that does the $88,500. Passages Malibu out in California. It is a private company, and it was started by Pax Prentice and his dad, and they claim to have 100% cure of addiction. Do you know why they have that? Because they stopped following the patients that were discharged after 1 month. That's how they claim to have 100% cure. Yeah. Most places, if they're really being scientific about it, physicians and other healthcare workers have a pretty high rate of getting treatment and staying in remission because we have a lot of things riding on the line, our licenses. And when the board holds that license and says, you need to straighten up and do this, that, and the other, we pay attention if our brains are still not, too badly messed up. So, is it effective? This is for the general population, okay? I would wager that for healthcare providers, the benefit's even better. The most important one is the savings related to healthcare are included. And we're talking about treatment programs, the cost that it costs just for substance abuse in the U.S. every year. The returns are 12 to 1. That's a pretty good investment, okay? It does cost a lot to get into treatment, but if you stay in treatment and recovery for the rest of your life, this is a tremendous return on what your investment was. Goals of treatment, basically to learn how to live life on life's terms and how to have feelings and recognize them and not be ashamed of them, and how to deal with pain and stress in ways that are non-destructive. I have a condition that causes chronic pain on a periodic basis. I'll get into that when you get to my personal story. Board and physician health program requirements is usually a 5-year consent order. Must remain abstinent from all mood-altering substances, group therapy, caduceus, individual psychotherapy if needed, 12-step meetings, regular evaluations from a monitoring physician, drug screening, random and for cause, multiple times a month, workplace supervisor. My fiance is a nurse, and several months ago, she said, "You ain't acting right." I was like, "What do you mean?" He says, "You just don't seem to be acting right." I said, "Well, I'll go drop a urine." Okay. Anybody who's in recovery who goes to if every time I go to the doctor, the very first thing I say to them, and this is including even the front desk, I'm a recovering addict and alcoholic, and I want you to put that on my record. Okay. Another thing is that if I go and if I'm treated for something medically and is a painful condition, I insist on having a urine drug screen witnessed and taken before any medications are given to me, because I don't want to be accused of, using the system to get a fix. Nor if I have chest pain and they give me morphine and then they do the drug test afterwards. Well, were you using drugs, and that's what led you to having, coronary artery spasm? No, I want to have a UDS before any treatment's begun. No self-prescribing or prescribing to family members, goes without saying. Family therapy is important. Workplace limitations, generally, those are such that no opioids or sedatives, you can't prescribe them. If you do have a patient who needs them, you have to go to your monitoring physician, the person you work with who is actually, mentoring you during your recovery. You go to him or her and they will write the prescription for you, okay? Work hour restrictions, neuropsych testing, in that case it was me. Prognosis, between 74 and 90% after 5 years. That's not bad. That's actually very, very good. The top one there is the same data from the previous slide. 90% of 197 patients, 9-year study, 83.8%, with no relapse at the end of 2 years. One relapse, success rate was 97.6%. That's John Coltrane, excellent musician. He, jazz musician. He died, I believe, at age 37. He was a heroin and alcohol abuser. The world lost an incredible musician when he passed away. My personal journey. Okay. 1996, I had just finished up my tour of duty in Germany. I had been a commander of 2 clinics over there. I'd just gotten a letter promoting me to major, but at the end of my 4 years, I had thought about coming back to the States and coming back to my hometown and opening up a practice. My godfather in Manchester reached out to me and said, hey, Georgia Baptist Healthcare System is willing to build you a practice if you want to come back here when you get out. So I had met my wife overseas, second wife. I'm on my third, not yet. I'm engaged. I'm sorry, I shouldn't say I'm on my third because that would be, that's putting the cart before the horse. But at any rate, we had married overseas and we were coming back to the States for me to practice medicine. At the Rural Health Clinic, 1997, my practice was really taken off because I was from the area. Everybody knew me, so I had a good patient base. Basically, my responsibilities grew, my titles grew. I ended up becoming director of the Roosevelt Institute for Physical Medicine Rehabilitation. I was I could just keep on going on and on and on with the quote titles, which is part of an addiction in and of itself. But at the end of 6 years, I was a wreck, okay? At this point, I'm weighing 240 pounds. My triglycerides are over 1,000. My legs and feet are swollen. I have a pale, waxy condition. I'm sweating all the time. I am pretty much a zombie hermit. The only time I leave the house is to go get my drugs or to get alcohol. My wife at the time was codependent, and she just thought I was really, really sick from another medical condition, which we'll get into. But I was in pretty bad shape. Well, in 2002, 2003, that was the last year that I was actively using. My baby girl was delivered on July the 11th of 2011. I tried to stay off of the drugs for her delivery. I was able to make it 3 or 4 days, but the withdrawal symptoms were so severe. As soon as I got home out of the hospital with my wife and our baby, I went back to using. Well, on the day of my on the day of my belly button birthday, my wife at that time, me and our daughter had drove down to Florida, where her daughter, my stepdaughter, was having hernia repair at MacDill Air Force Base. I don't remember overdosing. All I know is I was waking up in the emergency room of the Air Force Base. Someone had found me down in the hallway, brought me there. I was apparently apneic. I don't remember much, but I do remember this. I heard the ER doctor saying, he's dropping his sats, give him the Narcan. I knew what was coming next, and I hope that none of y'all ever experience it. If you're taking narcotics, opioids on a daily basis for 6 years, and you're given Narcan, you go into immediate withdrawal. And it is the most horrible sensation that I can possibly describe. Everything hurts. I remember yelling. Now listen to this. I knew that was coming, but my addicted brain was saying, well, maybe I can pretend that I just had an accidental overdose. I can sit up in bed and say, oh, thank God y'all got me on that. I feel better now. That's my brain telling me, you're an addict and you need this stuff, and you need to do everything you can to continue getting it. Well, that didn't work, okay? It gets worse. My wife looked into the camera bag and she found my stash of drugs, and I had written prescriptions for my stepkids that I had taken for myself. I remember her saying, I hate you. And the next thing I know is I'm transferred to another hospital, and I sit tight there until I go to Talbot. But I wasn't always an addict, or at least I don't think I didn't have NA and AA plastered across my forehead. That's me right here, the skinny kid, 1976. My father was a forester, my mother a homemaker. My brother, 7 years older than me, he went to college, medical school, became an interventional radiologist. I was a fairly normal kid. There was no history of abuse in my family. I had good friends. Neither one of my parents drank or used drugs. Now, they did smoke like chimneys, 3 to 4 packs per day per person. Seriously, it was that bad. They were the type that would have a cigarette burning in every room. They'd start smoking in one room, go somewhere else. I don't feel like going back there. I'll just light up another one here. It eventually killed my dad. In 1982, he died of lung cancer at age 56. So who's the addict in this picture? Who says the dog? Can you even see the dog? Well, that's me again, right here. I was 11 years old, 4 11-year-olds camping. As I said, normal childhood, good friends. But I remember something that happened when I was 12 years old. I had caught a cold in Christmas time. I was 12, and that cold turned into pneumonia, and we went to my family practice doc who prescribed an inhaler, some steroids because I had reactive airway disease, antibiotic, and a cough syrup with either codeine or hydrocodone. Well, got home, mom gave me the medicine. Well, about 30 minutes after the hydrocodone medicine, I felt great. I had never felt anything like that in my life before. I was cured. Yeah, I had pneumonia, I had a fever, I was still coughing, but I did not care. I was running around the house. I'm going to catch Santa Claus this Christmas. I'm going to stay up all night. I'm going to wrap so many packages. I mean, my mother and dad didn't know what the hell to do. She called our family practice doc, and he said, I think he's had a reaction to one of the medications. Just don't give him the cough syrup anymore. Well, he was right. About 4 or 5 hours later, I come down off the cloud, and I never think about it again, at least not until much later. No, I'm not passed out drunk. This is at a fundraiser when I was in high school at the Methodist church that I belonged to. We were raising money to go on a trip down to Florida, and I was in a rocking chair. It was a 24-hour rockathon. My first experience with alcohol. Oh, God, y'all should look at that and go, I had never drank alcohol before in my life until my freshman year at college. And I went to Furman up in Greenville, South Carolina, and went there and went to the local party store to ask, hey, I've never had anything to drink. What do you recommend? Why don't you try Wild Irish Rose? And it's like, okay. So I went back to the dorm, had a drink of it, and I felt great. I felt even better the more drinks I had. In fact, I drank that whole bottle. As an alcohol naive person, I drank that whole bottle. And why did I drink that? Because the more I drank, the better I felt. Well, the next day, I didn't feel that good. I mean, I was in bad shape. And I swore at that time, God, I don't want to ever do that again. That was horrible. And for the most part, that's true. I did not drink to excess again. I did drink some in college, but I was pre-med, a chemistry major, very goal-oriented, got to get in medical school, got to have perfect A's, I'm in the military ROTC, so I got to keep myself straight for that. So there wasn't that much time for partying. But I did notice that by the end of my senior year or so, or beginning of senior year, it was taking more alcohol to give me a buzz. Well, I didn't think anything about it. Alcohol was cheap, so I bought more. Whoops. So, yeah, I know I look like a dork, but the Thunderbird is really cool. That was my favorite car. 1987, I graduate from Furman, and I go to Medical College of Georgia. Now, I did get accepted here at Mercer, okay? I want to say that. And I really considered going here, but because my brother went to MCG, I kind of felt like I had to do the family legacy thing. So I went to MCG instead, but I really considered coming to Mercer, okay? Anyhow, off to med school I go. Oh, by the way, I got accepted early in my senior year, so you would think I could party and have fun like it's 1999. Actually, it's 1984 is when Prince came out with that song, I think. But no, I really didn't party that much after that. In fact, I wanted to continue to do well because I felt like I was becoming part of something bigger and better than myself. Another picture of the T-Bird. Oh, it was a beauty. 9 miles to the gallon, Medical school, 87 to 91. Okay, med school's hard, all right? Everybody agrees to that. Go to class for 8 hours, then study, anatomy lab, take a test, do more studying. After test is over with, go home, take some drinks, go out and have drinks. Well, now my alcohol consumption is changing. Whereas many of my classmates who drank heavily drank in order to celebrate, I was celebrating being able to drink. Meaning the drinking was now the important reward for getting a test done with. It wasn't the test that was over with. It was because the test's out of the way, I can drink now. And my grades began to suffer, okay? By the end of my medical school career, in 1991, I started experimenting with drugs to be able to deal with the fatigue of being up all night on call, studying late, et cetera, et cetera. It never occurred to me that my drinking was causing hangovers, and that's why I was looking at substances to try to boost through that. Well, it never really affected my grades that much, but by the end of my medical school career, I had stopped using drugs because I knew I was going into a residency program and I didn't want that to have any effect on me. Intern year, 91, 92. I got married to my first wife, who was also a medical student who became a physician, and I went to the same internal medicine program that she went to, although she was a year ahead. And things were going really well, at least professionally. But at home, we had a bad marriage. It was not an emotionally supportive marriage for either one of us. And as a result, I turned back to things that I knew that would help me cope, alcohol and drugs. Well, this is a picture of me up on the rocks in Gatlinburg, Tennessee. And my wife at that time had taken a photograph, and when she put the camera back into the camera bag, she discovered my stash of drugs, and that was that. And before I went into the Army in August of 92, we had gotten a divorce. 92, I moved to Krelsheim, Germany, and I am in great shape because my drug use is behind me. I'm divorced. I'm a single captain in the Army. I'm going to Germany, and I'm starting my life over. That is also where I met my second wife. This is she and I. We're in Hungary, overlooking Lake Balakaton. I'm in my dress greens. And she's actually a Dodge teacher, a Department of Defense teacher, and that's how we met. Of course, Germany is the capital of beer production, and I made sure that I engaged in as many types of beer as I possibly could. Did not do any drugs because I was actually being monitored by the Army. We had to do periodic UDSs. But the other thing is I wasn't really tempted to do drugs. I was in a leadership position. I had a career ahead of me. My life was good. The only thing I did abuse was alcohol. When did I start drinking? Within 5 minutes after I got home. And I would stop at night and hope that I was not hungover the next day. That's me in my captain's uniform with the railroad track bar on my cap. Thanksgiving, Germany, 1994. I come down with a fever of unknown origin after 2 weeks being, for 2 weeks, associated with a headache, weakness, euphoric feelings following vacation in Greece that involved going off the beaten path. Full recovery after about a month, diagnosis the flu. Symptoms return in 6 months and intermittently for 2 more years. Workup started in late 1995, but discharged from the Army before a workup could be complete. This is important. Moved back to Manchester in 96, opened up my practice. Autumn 97, same thing. Fever, headache, chills. This time I was up in Atlanta, and I was taken to an ER. They were getting ready to do an LP on me, a spinal tap. And they were going to send me back to get a CT to make sure that if they did the tap that I didn't have a tumor up in my head that would cause the brain to herniate. Well, anyhow, they gave me an IV injection of Toradol, which is an anti-inflammatory. It's an NSAID. And within 15 minutes, I was back to normal. I woke up in the ER and like, what's going on here? By the way, I wasn't, at that time, I definitely was using drugs, but I had not gotten to the point that it was later. Sorry, definitely drinking alcohol. I wasn't using drugs. I apologize. The ER doc said, I don't know what you have, so I'm sending you to an ID specialist. At the appointment, he does a complete evaluation. What's your diagnosis? I had never heard of it. Mulleray's relapsing meningitis. Medications to keep it in check. Steroids, NSAIDs, opiates, Imitrex for the migraine and for the headache as well, and acyclovir. It is thought to be a virally mediated disease caused by the herpes simplex virus in the CSF, in the central spinal fluid. I had never heard of it. My ID doc said, it's going to come and go for the rest of your life, and I hope you have a good disability insurance policy. Well, I did not like to hear that. I had spent my life training to be a doctor. So I went on for years. I got prescribed OxyContin. It worked initially. Okay, then I escalated the dosage because it wasn't working as well. That was because I was getting tolerant to it. Finally became dependent upon it. This book is fascinating. Okay, it's about the Sackler family, which is the family that developed OxyContin. I highly recommend you read it. The first time I read it, I couldn't put it down because it was like a mystery novel. I read it a second time because I wanted to get all the facts, because every time I turned the page, I was like, I can't believe this happened. I cannot believe this happened. Empire of Pain by Patrick Radden Keefe. Tired of paying expensive prices for imported German beer, I started brewing my own. My rationale was, hey, if I'm making it myself, it's not really alcohol. You're right, okay. My mom and I in 1997, in front of my office. 1999, I'm bloated. The alcoholism is already taking a big effect. I am wearing 3 shirts and it's summertime. Why? To cover up my withdrawal sweating. It's getting bad, but it's going to get worse. By now, though, I've already got so many titles and so many responsibilities, I'm thinking, nobody's going to bust me on this. Nobody wants to bust me on this because, I'm an enabling community. Okay? This is all rationalization on my part, things that I had to deal with when I got into treatment. Well, 2000, 2001, things are really getting bad, okay? I'm rounding at night so that I don't have to make eye contact with my patients or with the nursing staff. I try cutting back on the narcotics. I can't. The withdrawal symptoms are too severe. I'm not high anymore, and I'm not even feeling any type of performance enhancement. Every day is a struggle just to get out of bed. I go to work. I come back home, I drink, I use, I go to bed. It's a horrible situation, and my poor wife is dealing with this, okay? We were married for 25 years. We'll get into that in a minute. But she was codependent, as well as a lot of people in my community. January of 2002, I have another severe attack of Mulleray's. This time I go to Atlanta. Finally get that lumbar puncture. And guess what? It proves the Mulleray's meningitis. Okay? At that point, I go on disability because my doc says, you got too many problems. But you know what? He didn't mention at all anything about addiction and alcoholism. It's because I didn't share it with him. And this is late 90s, early 2000s. We weren't looking for things like that in healthcare providers. We didn't want to look closely at that because it might be looking at a mirror image. 2002 to 2003, I am pretty much out of it. That's why it's blank. January of 2003, that's where I have the OD at MacDill Air Force Base. And before I know it, okay, by the way, what is this? What is this an image of? Right. That's where everybody was, in denial. I'm glad you laughed. Yeah. I couldn't laugh back then, but now. So, rock bottom. You'll know it when you hit it. I did. I lost my practice. I almost lost my marriage. Bankruptcy in 2004. I was on disability. And I went into treatment, and that was the single best thing to happen to me in my life. You think my family missed me? Hell no. Goodbye, get out of my hair. It was the single best thing for them too, because it gave them a chance to look at things and realize they were codependent. That's where I went. 6 months. It saved my life, and I watched it save a lot of other people's lives. Rehab cost $34,000. Random urine drug screens for 6 years for the board, 5,760. Quarterly letters were 600. Bankruptcy, thousands of dollars in research to get into rehab. I want to say that I retired from medicine not because of the drug use and alcohol. Actually, I completed my board order for the Georgia State Board of Medical Examiners, but when they looked at my medical history and the cognitive problems that I've had since the Molaraise attacks, and since they continue, and since when they do occur, I am impaired from that. I don't take opiates. I have learned to deal with pain in ways, Talbot taught me that, how to deal with chronic pain, and because I know as soon as I go back on opiates, I may have another relapse, but I don't know if I have another recovery in me. So I have elected, and my doctors have said, you don't need to go back to practicing medicine. I highly recommend everybody in this room, if you do not have a disability insurance policy, is you look into it for job specific. Aversion therapy? Yeah. Who knows the movie, by the way? Can anyone tell me? Yes, Clockwork Orange. Right. Anthony Burgess wrote the book. That's Malcolm McDowell. I know in 12-step organizations we're supposed to remain anonymity at the level of press and film. All I'm saying is it helped me. And I've watched it help tons of people who did not have the money to go into rehab. September of 2003, I'm clean and sober for about 6 months, and that's my baby girl, Genevieve, with one of my former patients, Pearl Hosier, who was celebrating her 100th birthday. I am out of treatment, and I am sweating like crazy. And this is an air-conditioned environment. It's withdrawal, okay? It sucks. But I knew what would happen if I started back using again. I'd feel instant relief, but then I'd be right back on that merry-go-round again. That's my brother and his wife, Becky. We're almost done. I got to give credit to him. He paid for my treatment because I was basically busted without money. In 2014, I finished paying him back every single dollar. He said it was the best investment he's made. That's him with his family, his son next to him. Those are his stepkids, stepdaughters. Mom and I, in August of 2014, Mom saw me go through a lot. She had broken her hip, had a stroke, and I was saying goodbye to her. She said, son, you don't have to relapse over this. 2019, my marriage busted. I had done so much damage, it was irreparable, and I acknowledge that. We did go through counseling and therapy, but it was irreparable damage. Even though she stayed with me for many years after that, it was never quite the same. I will say this, that our daughter, Genevieve, when this happened, I also increased my meeting attendance and also increased my urine drug screens. Because in a divorce, you don't want to have anything that says that, hey, he might be relapsing. Our daughter was still not an adult, and when my attorney said she needs to sign a paper that says, who she want to live with, she wrote she wanted to live with me. And the attorney said, it's rare that you see that the daughter ever wants to live with the dad, and it's almost impossible if that person has addiction and alcoholism. But my attorney said it's because you're in pretty good recovery. So what am I up to now? New relationship, engage. You'll see her in a minute. Support group meetings. I volunteer, do medical reserve corps for DPH, give talks on substance abuse and dependence. This is my first one since before COVID, so I'm a little, you can tell I'm like tongue-tied sometimes. I will drop a urine if you think it's because I'm using. I'm an amateur actor, performer with the Columbus Ballet. I've actually been in a rap video, I know. Avid reader of history and science fiction. I'm a historical European martial artist combatant. I am looking for a trainer, anybody who wants to do that. And I'm accepting living life on life's terms. That's us at Providence Nursing Home in Thomaston. We were the first group in Georgia to actually go into nursing home when the COVID-19 breakout occurred. And that's our team. Scrooge has an intervention. That's what Christmas Carol is about. It's an intervention. And I played Scrooge in that particular production. And this is proof that you can play on a guitar that B.B. King once played. On December 31st, 2014, play tabletop Dungeons and Dragons with your best friend from high school and be completely sober and have a grand time. Me as Dr. Coppelius in Coppelia. It's one of the only ballets that's a comedy. Most ballets are tragedies. But this one was physically the most demanding one of performances I've done. That's me and my baby girl. She was Sugar Plum Fairy that year in Nutcracker. I was Drosselmeyer. Okay, the beard's real. Took 3.5 years to grow it. I went to Dragon Con in 2023 as Saruman from Lord of the Rings and The Hobbit. I was channeling Christopher Lee that day. And my poor suffering fiance, once the competition was over with, she brought out the electric shears. She was like, it's going. Another Nutcracker 2023. This is this past year, or actually just like September, less than a month ago, as Saruman, young Saruman, because he had his beard shorter. Jen and Eric, he is a PhD student over at Augusta University. And my little girl, they just got engaged. He came to me and asked me for her hand in marriage. I said, Eric, if you're asking me, don't tell her that because she'll kick your ass. She don't need you to no. And finally, 2025, this is my family, immediate nuclear family. It's Keely, my fiance. She's a nurse, RN, over at Upson Regional in quality. She has been an ER nurse. She's also done psych medicine, so I can't pull any shit over her. She can see right through it, which is great. My daughter, her fiance Eric, and my soon-to-be stepdaughter Kinsey and her brother James. And that's the end. I know I went over time, and I apologize for that. I just want to say thank y'all for letting me talk. And I can tell you that there is life after getting into recovery. Thank you again. Any questions? So, or are y'all so hungry or ready to go eat? What's that? Okay, yeah. All right. Okay, well, thank you again. Thank you.
Thank y'all so much. We're going to move into, We're going to move into lunchtime. So if you will go ahead and get your plates, it's right out here at a buffet style. If you'll go ahead and get your plates and then come back in as soon as possible, because we invite you to go ahead and start eating, and then we're going to watch the film during the program. But I do want to say before that, we have Mercedes Madrid Lowry, who's in the back, and you see her there. She is an LCSW, and some of the things that you're going to see in the film may be very hard to deal with and to take. And I know today can be emotionally charged for many of us who have had opioid misuse in our families. And so if there is something that bothers you or disturbs you and you need to debrief with someone, we have a bunch of amazing LCSs in the room. But we also have Mercedes. This is a busman's holiday, y'all. We also have Mercedes that can speak with you out back. You are welcome to get up and leave the room if you need to, and we encourage you to do that for your mental health. So, yes.
I have two announcements. So Kelly, the gentleman in the green shirt that's next to the CWC table outside, they are doing a drawing for a free 6-hour MAT, medical assisted treatment training. So encourage you to put your business card in there for a free 6-hour training certification. Also, Christopher has a gift for you all today. We have shirts that we're giving out for free. You'll need to go and get your size. We tried to guesstimate what sizes, so hopefully we'll have your size. But I just want to say the 18 on the sleeve represents him and today and his birthday. So please get your shirt for today as well. And enjoy lunch.